Today, we're focusing on hyperthyroidism. This session is part of a medical brief series. People with hyperthyroidism often experience weight loss despite having a good appetite, which might seem surprising at first. They also commonly suffer from heat intolerance and excessive sweating, reflecting the increased metabolic rate. Additionally, palpitations and tremor are frequent, resulting from the heightened stimulation of the nervous system. Anxiety and irritability are also common, showing how this condition affects both physical and mental health. Increased bowel frequency is another symptom to watch for, alongside fatigue and proximal muscle weakness, which can significantly impact daily activities. For women, menstrual irregularities are often observed, linking the thyroid dysfunction to reproductive health. Common cardiovascular symptom is tachycardia or atrial fibrillation, which reflects the increased metabolic activity. Patients often exhibit a fine tremor of outstretched hands, along with warm, moist skin due to increased blood flow and sweating. You might also notice lid retraction and lid lag, which are characteristic eye signs. A diffuse or multinodular goitre is frequently present, indicating thyroid gland enlargement. Hyperreflexia or exaggerated reflexes, and proximal myopathy, which involves muscle weakness, are other important features. Specifically, in Graves' disease, which is a common cause of hyperthyroidism, unique signs include exophthalmos, ophthalmoplegia, pretibial myxedema, diffuse goitre, and thyroid acropathy. When assessing the thyroid gland, it's important to check for size and symmetry to identify any enlargement or irregularities. We also look for nodules, tenderness, and the presence of a bruit, which can indicate increased blood flow associated with hyperactivity. Next, we assess the eyes carefully because changes such as bulging or irritation can be signs of thyroid eye disease. We monitor the pulse to detect any abnormalities like a rapid heartbeat, and check reflexes which may be brisk in hyperthyroid patients. Finally, evaluating proximal muscle power helps us understand if muscle weakness is present, which is another potential symptom. When we suspect hyperthyroidism, the initial investigations we perform include measuring thyroid-stimulating hormone, free thyroxine, and free triiodothyronine levels. These tests help us confirm the diagnosis by assessing thyroid function. To further clarify the cause, we may check for thyroid receptor antibodies and thyroid peroxidase antibodies, conduct a radioactive iodine uptake scan, or perform a thyroid ultrasound if indicated. The main options involve a combination of definitive treatments, antithyroid drugs, and symptomatic control. For definitive treatment, radioactive iodine therapy is commonly used, and thyroidectomy may be necessary in cases of large goitres, suspected malignancy, compressive symptoms, or when other treatments aren't suitable. In terms of medication, carbimazole is the first-line antithyroid drug, except during the first trimester of pregnancy and in thyroid storm situations, where propylthiouracil is preferred. To manage symptoms like tremors, palpitations, and tachycardia, propranolol is widely prescribed. It's important to recognize that hyperthyroidism can lead to several severe complications if left untreated. For example, a thyroid storm is a life-threatening condition characterized by an extreme overproduction of thyroid hormones. Additionally, hyperthyroidism can affect bone health, leading to osteoporosis, which significantly weakens bones and increases fracture risk. Cardiac issues are also common, with atrial fibrillation and heart failure posing serious risks. If you found this video helpful, please like, subscribe, and share to support our educational content. Thank you for watching.